Welcome back to Great Day, everybody. Since COVID-19 shut down the world as we know it, there's been a disturbing trend. People who need medical attention but just won't get it out of fear. Deborah Duncan, she is a doctor too, actually. Deborah Duncan spoke with Dr. Eric Roberson with Neighbors Emergency Center about how they're keeping their ER safe and why you still need to make the visit.
Dr. Roberson, a lot of people watching the news and seeing these stories at hospitals are a little skittish about showing up, even in the case of an emergency. But with Neighbors Emergency Center, it's a little bit more of an intimate situation.
Correct. Yeah. And at Neighbors, we're a smaller center, or smaller centers, meaning, we don't have 15, 20 rooms, smaller staff. And that being said, we're able to get patients in private rooms, which is actually very important in the emergency setting, particularly with a disease like COVID that kind of hangs around in respiratory droplets for a while. When you're in a private room, that mitigates the exposure and spread to some degree. So yeah, we're able to do things that larger hospital-based emergency rooms do, and I just think we do it quicker and more efficiently.
Yeah, and I want to stress that again, that yes, you're a smaller, different setting, oftentimes in those freestanding buildings, but you have the same skills and the same skilled people to take care of any kind of emergency that the big hospitals do.
Oh yeah, absolutely. Most of the docs, and throughout the Houston metro, we have 6 centers. So we employ approximately 50 physicians. All of the docs are board certified emergency docs. And, very honestly, most of us are kind of mid-career like myself. So it's not uncommon to have a doc that's been practicing in a level 1 trauma center for 15 or 20 years. Now we're able just to step out of that center, out of the hospital, into like I say, a more intimate setting. So the skill set and the diagnostic capabilities are there just as we were in a large hospital.
COVID grabs all the health headlines, but the other issues that we've had, for example, the #1 killer in the world, heart disease, that still goes on, strokes still go on. The pure nature of being an emergency means it's most likely not going to get better, and time is of the essence. You have a couple of examples of people who are putting it off because they're afraid to come in.
Yeah, absolutely. And, that's something that we're seeing across the country where patients are actually delaying care for fear of COVID. One gentleman was a mid-30s guy that had 6 days of shortness of breath. And when he presented, I worked him up as we do all patients with shortness of breath, chest x-ray, blood work, EKG. And it was clear in the first 10 or 15 minutes that this gentleman had had a heart attack. And the symptoms that he presented with, which were shortness of breath, were just a manifestation of the congestive heart failure that he was having as a result of kind of a heart attack that happened 6 days ago that just wasn't properly managed.
Yeah.
And then right after that, had another gentleman, diabetic, hypertensive, that had a diabetic foot ulcer that waited for well over a week, again, just fearful of coming in. And that gentleman needed IV antibiotics and a surgical consult for debridement. So those are 2 very simple examples that I saw just last week of patients that should have come in a week earlier, but didn't because of their fears.
Yeah. The other thing that makes it a little, you can contain kind of the COVID situation is that you don't have long wait periods in your room.
No, not at all. Not at all. And, at most of our centers, we directly bed. So you come into the center and you present with your ID and we get you immediately to a room. And just based on our volumes and the type of setting that we're in, on an average day, it's uncommon for a patient to have to sit or wait in a waiting room. You're usually immediately in a room within minutes of presenting. So again, in this fear of COVID, that's important because you're not, mingling with other patients that are potentially infectious.
Dr. Roberson, the other thing that stops people from coming in sometimes, and this is the sad part, is they think, can I afford it? You want them to put their health at the top of that list, and you can work through the other stuff with them later.
Oh, absolutely. As a matter of fact, when we see patients, and personally, I'm glad that we do things the way that we do. And this is true for most emergency centers. I never know what a patient's financial ability or means are when I'm seeing them. So treatment is always, patient safety and treatment is first. And then I always kind of say that the financial part, that's handled on the back end on the way out the door. So it's never kind of a concern for me or the patient when it comes to ability to pay for services. That's always handled on the back end.
All right. So when people show up in today's climate, you provide masks for them. The other thing is that you all have gotten, obviously, you know how to do certain health protocols, but you've gotten extra training specifically dealing with COVID-19.
Absolutely, absolutely. I mean, so like you mentioned, we screen all patients for COVID. Provide masks, and the masks are worn from the time they enter the center to the time that they leave. And we sanitize the center per the CDC recommendations. We don't allow visitors back with patients either, with the exception of minors. And you're correct. All of our staff has undergone specific training, and techniques that help mitigate COVID transmission among staff and patients.
All right, so just going to stress again, if you feel like you are in the midst of an emergency, a stroke, a heart attack, it could claim your life if you wait. So get in ASAP.
Absolutely. And, we have centers across the city, from essentially south suburbs to the north part of the town. All of our centers, are adequately staffed. We have, again, board certified docs, easy to locate in the community. So yeah, if you have an emergency, I mean, you just have to come in, give us the opportunity to make things better.
All right, Dr. Roberson, thank you very much.
Right. Thank you for having me.
For more information on Neighbors Emergency Center or to find the nearest location to you, log on to nec24.com. That's nec24.com. And parking is not a problem.